Are you giving your OSCE examination anytime soon? Then you must watch this video because I'm gonna give you 5 examination tips that may help you to pass your OSCE examination. Hey guys, my name is Reema and I'm one of the nurses in Australia. I've also given the OSCE and NCLEX here in Australia to get my registration. So here are some of the tips that I learned during my examination that may help you as well. So you can watch this video if you're going to give your examination anytime soon. Let's not delay and start the video. Number one tip is reading your OSCE manual handbook. You can see here in the picture how does the manual handbook looks like that the AFRA have given to you. I would recommend highly to read this manual handbook before you even start thinking about your OSCE examination, because this is the book that contains all the information that you will need to pass your OSCE examination. It includes the information from before how you prepare for the examination to end of the examination. So I highly recommend to read this manual handbook. So I have highlighted few points from this book that are to be read by the candidates so that they can pass their OSCE examination easily. There are more information than this than that I have shown in this video. So if you want to know more about the OSCE examination, then you can definitely go and read the whole OSCE examination manual handbook. So in this video, I'm gonna just talk about the 7 things that I saw which are very important in the handbook. So let's start. Number one important thing that I find in this handbook is what does the OSCE assist? So when you are giving an examination as a candidate for the OSCE, you must know what you will be assessed on so that you can improve yourself on those criteria, right? So you must read this. I have shown the picture in here. This information can be found in page number 7 of the OSCE handbook. So it says what does the OSCE assist, as you can see in the picture here as well. I'm reading from the photocopy. So it says the person will be like assist on specific clinical skill and their ability to manage the care of a patient in a holistic manner. So if you read this whole paragraph, then you will know what kind of criteria are there the person will be assessed on. So please read this section. What does the OSCE assist? Another important thing that you will find in the OSCE handbook, it can be found in page number 8. The topic is what skills will candidates be assessed on. You can also see here in the picture. So this is what skills will candidates be assessed on. It has got the list of the practical skills, as you can see here as well, that are like physiological observation, vital signs, calculating the drug doses, intramuscular injection, resuscitation, which is basic life support, medication administration, wound care, and the list goes on. So these are the practical skills that AFRA will assist you. So these are the things that will come in your station. So make sure you know about these practical skills beforehand you go in your examination. Okay. All right, so next is OSCE station focus. So I have also put this one in here. You can see in the image. So it can be found in page number 9. I'm sorry, I'm using my photocopy as well, so it's easy for me as well. So here you can see in the pictures, it is divided into 3 domains. So the one is nursing assessment and care planning, another is care delivery, and another is evaluation of care. So these are the stations that will come in your examination. So please read this in your manual handbook. So in nursing assessment and care planning, it has mentioned that it will gonna check on you vital signs, focus nursing assessment, and risk assessment. So in focus nursing assessment, it means it's gonna like give you the assessments such as respiratory assessment, cardiovascular assessment, and in risk assessment it will be like mental health, fall risk, pressure injury assessment. So another is care delivery. So that includes the medication administration, basic like support, aseptic and ANTT principles, pain assessment and management, IV fluids, blood transfusion, and evaluation of the care includes the interdisciplinary communication. So these are the OSCE station focus. As you know already, you will be given 10 stations. So 10 stations is divided in these domains. So these are the stations that you're gonna get. So it's clearly given in your OSCE manual handbook. So please be familiarize yourself with these three domains that are very important for your examination. Okay. So another important information that's given in your OSCE handbook is about the forms and charts. So in your OSCE manual handbook, it has been clearly given what are the forms and charts that you may need to familiarize yourself with. It can be found in page number 10. So it includes all the charts and the forms which you can see also in the picture. So it includes the charts such as medication chart, vital signs chart, neurological chart, blood glucose chart, fall risk chart, pressure injury chart, mental health chart. So please be familiarize yourself with the charts and forms that you will get in your examination. And once you do the procedure in your examination, you may have to record all the clinical information that you find out after your examination. So you will have to go and enter in these charts. So please make sure you get familiarize yourself with these forms and charts. So the links for the charts and the forms are given in the OSCE manual handbook itself. So if you open that one, then you can easily go in that forms and charts and you can download it so you can learn more about it. Okay. Another important thing that you need to know is examination setup. Of course, when you are gonna go and give the examination in the other state or in a new place, then you will get nervous. You will think, what does, like, what kind of questions will be there? What does the room look like? How will be the setup? And if there's a new setup, of course you will be nervous. So OSCE have, like, this manual handbook have also provided you the pictures of the stations and picture of the place that you're gonna go and give your examination. So I would suggest strongly to go and check these pictures out. So in your examination, you won't feel overwhelmed and you feel like you have already been there and you are familiar with the place. So you can find this picture in here as well. Like you can see, it will be in page number 11, 12, 13, 32. So this picture shows like how does the OSCE station looks like, what are the equipments looks like, and how is it, like, prepared for you guys, so it's easy for you. That's why I'm telling you, please read the manual handbook. It contains the information like this, which is very helpful for your examination, which is very important from the examination point of view. Okay, it will definitely help you to reduce your anxiety in terms of the location. All right, guys. So another critical information that's been given in the OSCE manual handbook is what to do and what not to do during the OSCE examination. So you can see in the pictures here as well. In here you can clearly see it have reminded the candidates that remember that candidates are assessed on the level of an Australian graduate entry registered nurse. So it's not going to be very complex skills, or they're going to assess you on, or advanced care, like, advanced type of skills that assess you. They are just going to assess you based on, like, how the Australian graduate entry registered nurse are assessed in here. And another thing they have also clearly mentioned, which I have highlighted here, is not just focused on the completing the task alone. So please don't be task focused. Please consider the clinical scenario as a whole. Like when students usually go in exam, like they are so task focused that they forget what's going on in the environment. They don't care about the safety. They don't care about what the patient is like doing, what they want. They completely forget the empathy. So please don't be task focused. Be focused on the clinical scenario and make sure your patient is safe whatever you are doing. Okay. Okay, another important thing that you will need to see in the manual handbook is documentation. You must be aware already that you will need to do the documentation once you finish your clinical skill. So you need to familiarize yourself with the charts, that's why, okay? And also in the AFRA handbook, you can see in the picture as well, in page number 31, 32, it has like given information that you will provided the pen and paper so that you can write the information that you will find in the questions. But this paper is not to write your clinical documentation that you find in your examination. There will be the separate charts and forms inside when you go there, so which is also mentioned in this manual handbook. So that's why it is important to read the handbook. It has also shown you the pictures, like you can see here, the medication charts, the vital signs charts, how you can record your clinical documentation you need to do. It has also clearly mentioned how to do it. So you can see in the picture here, how it has shown you the previous examiner have done the thing. So please read the handbook, so it will be easy for you in your examination to check out what kind of information or clinical documentation will be inside your OSCE station, and how you're gonna record your data that you will find after your certain procedures, so you can record it in a correct way. Okay, so those were some critical information that you will find in the OSCE manual handbook that will be very important for you before you give your examination. So make sure you read your OSCE manual handbook. These are only some highlights that I find out that are important for you guys. So if you need more information, please read the handbook from page 1 to 42. Okay, and next tip is developing your script. Developing your script will help you to run your whole procedure smoothly. However, please do not read out the script when you are actually giving your examination. Sometimes students like have made the script and then they just go like, you know, how they are reading the book, blah 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 blah, blah. Don't do like that way. Please make sure you deliver your script as how we communicate with each other. There should be empathy on it, there should be like, you know, acknowledgement in it. So that's why it's very important how you deliver your script. And script can be changed, or like it should be flexible, so that it can be changed as per the scenario that's been given. Sometimes there may be a different scenarios which may not go along with the script, however the procedure may be same. So you should be able to change your script when you are actually giving your examination. So please remind yourself that the script is not everything, however it's just a guide for you to run your procedure smoothly and to save your time. Okay. Number 3 tip, developing a muscle memory. What's developing a muscle memory? So it means when you are doing any procedure, you should not be thinking about in your head. It should go on the flow. If you practice it more and more and more, it will happen like that way. For example, in procedures such as vital signs and basic life support, these muscle memory are really helpful, because it will help you to run your procedures smoothly, and then you will go step by step which will be necessary for these procedures. Okay, so this muscle memory can be built up from the practice only. So you have to practice more and more and more, where you need, like, you know, really this kind of things. For example, in medication administration as well, for IV administration, before you, like, you know, draw out your medication, you need to make sure that you clean the vial and all. So these all come under the muscle memory. So if you have already got the muscle memory, you don't have to think about, oh, I forgot this step, oh my god. So something like that. So if you clearly remember, like if you have practiced more and more, you have already developed your muscle memory, which will definitely help you to like run your whole procedure smoothly. And it will also help you to save your time. Okay, so practice, practice, practice. So next one is familiarizing yourself with the forms and charts that has been given by the AFRA. As I have already mentioned before as well, there are different forms and charts that has been mentioned in your manual handbook. So please print out those forms and charts. So when you practice this procedure, make sure you do these forms and charts. You read out these forms and charts, and you make sure where you have to do the clinical documentation in the charts. So usually when I used to read the forms and charts, I used to make my own note. For example, if I'm doing using the vital signs chart, then I will make sure what where are the points that I need to record the things like temperature, heart rate, respiration rate, saturation, so that like in examination I don't have to go and find it where it is, I have to record. Okay. And also like when I do this vital signs chart, I used to make my own questions, such as I used to make, like, you know, important questions that I need to ask before I start this procedure. So I used to ask, like, I used to make a note, like list of questions. For example, in vital signs chart, I will say, have you had any caffeine or done smoking in last 20 minutes? Have you had done any extraneous exercise in last 20 minutes? Have you have history of any disease conditions such as your high blood pressure or any heart conditions? Something like that. So I would make a list of the questions that will go with that forms and charts. So later on, when I go in the real examination scenario, I won't be hesitating to ask any questions, and I won't be wasting my time to read those forms and charts. Okay, so it is very important to read all these forms and charts. There may be a slight difference in your examination, like, you know, because like Australia have so many state, and they may have their own kind of charts and forms. However, it doesn't matter what does the forms and charts looks like, the content will be similar. So like, of course, if there is a virus and chart, then it will be similar, like, it will contain the blood pressure, it will contain the heart rate, it will contain oxygen saturation, pain level, and these all. The forms and charts may look different visually, but however the content inside will be similar, and it will be similar with all those other fall risk assessment chart, pressure injury chart as well. So don't worry, please remind yourself that these are the questions you need to ask if you get this scenario, or if you get this station. So it will be helpful for you. That's why I say, make your own questions, build your own questions, and make a list of those questions, and make sure you get familiarized with the charts way to record, and it will definitely help you to run your procedure smoothly, save your time, and build your confidence. Okay. All right, so last tip is recording yourself. So please do not forget to record yourself when you are practicing your OSCE examination. Recording yourself will help you to find out the mistakes that you are repeating in your habits. Sometimes, like, people have habit of using the filler words such as too much in while they are communicating. So if you are using these words too many times, and you can see in your video, and then next time when you practice, you will be like, aware about what you are talking about, and how about using these filler words. And similarly, it will also help you to find the non-verbal cues such as hand gestures, how your hands are working, your eye contact, where you are looking at, are you looking at the walls, or are you looking at the person, and how you are talking with them. So this kind of things are very important in the OSCE examination, which are also mentioned in your OSCE manual handbook. These are considered as like non-verbal communication cues. So these are important for your marking as well. So please make sure you record yourself, and see how you are managing your time, and see how you are using the fillers, how you are using your hand gestures, how you are using eye contact, if you're giving your smile, how is your body language. So all these things are very important during the OSCE examination. Okay. So please make sure you record yourself, and you can also send it to your instructor if you are practicing it in your institute, or it's just a record for yourself. Okay. So this will definitely help you. These are some of the tips that I used during my OSCE examination, which also helped me to pass. So hopefully this video will helpful to you as well. Of course, the tips are not limited here. There are many more tips that like, you can use in the OSCE examination, which you can also find in my previous videos, which I have already uploaded in the YouTube. I have also given the link up here. You can click in the link, you can also watch the video over there. If you have any questions related to the OSCE examination, or anything you want to learn, or you want to like find out more about it, you can message me on my TikTok, on my Instagram. You can also follow me there and message me there. I would like to say thank you so much for watching this video. If you like the video, please do like, comment, and subscribe my channel, and I will see you in my next video. Please don't forget to follow my channel. Thank you so much.